of extraordinary talks that have been going on during the course of this last week. My commendations to the IGF Secretariat for having done an excellent job in all of the work, and also to the MAG for selecting such a large and interesting group of sessions. This year, the MAG actually posed a question to the community, and they asked, can the IGF fulfill its promise to be the platform that leads to the development of globally applicable, rights-based public interest norms and principles for internet governance, policy, and regulation? In our view, this workshop itself is a real-world example of that. We confirm basically that the IGF is doing just that. And in fact, we've had years now of serious discussion here at this forum and across the broad spectrum of the multi-staker community. And this has brought us to this moment where we're about to step up to the next phase in the development of a set of harmonized rules and appropriate laws to enable safe international dispensing of medicines. I hear a little bit of background noise. I'd just like to make sure that everyone is in a mute if they're not speaking, please. And Mark, if you can monitor that, thanks a lot. Purchasing safe medicines over the internet is really a complex problem by virtue of the distributed nature of the internet itself. However, it's broadly agreed that using the internet to buy medicine should be no more difficult than buying a book online, provided certain standards and norms are in place to ensure that highly regulated industry can function as safely within the confines of the internet as it has for the last 100 years in the real world. And while the transnational nature of the internet creates the most significant complexity, or part of the complexity, as detailed in Dr. Ahmad's IGF Berlin discussion paper, which he will be sharing a little bit with you in this session, from whom you'll be hearing shortly, it's not the violation of federal or state laws that threaten public health. Rather, it's the actions of the rogue pharmacy operators who sell fake or otherwise dangerous medication over the internet. So what we're trying to resolve here, what we're striving for, is what's been called the regulatory sweet spot that avoids both the pitfalls of over and under regulation of internet pharmacies while mitigating the rogue actors. Most importantly, however, this is a rights-based discourse, and it's keeping people front and center. We're discussing a human rights issue at the core of all this discussion, and that requires all of our minds to resolve it technically. So this ongoing discussion around access to medicine is also rooted in the Sustainable Development Goals, particularly 3.8, which speaks to access to safe, effective, quality, and affordable medicines. The Brussels Principles, upon which the foundation of this discourse has been built, affirms access to affordable medical products is a fundamental component of right to health. Consequently, there is a call for greater flexibilities within national and international law that balance access and choice and consumer safety. And looking at this conversely, public health concerns have arisen regarding current restrictive enforcement approaches, particularly in a COVID-19 world. Examination indicates that we currently have a hybrid regulatory regime, whereby private actors have stepped in and taken it upon themselves to shape internet regulations which effectively disproportionately restrict access to safe and affordable medicines. Digital privacy experts and advocates have awakened us to shadow regulation in the absence of internationally accepted internet policy perpetrated on consumers by internet intermediaries and pharmaceutical industry. The .pharmacy top-level domain has been identified as having the potential to be a positive instrument, but fundamental changes are needed to its currently overly restrictive rules, and industry influence management must be made for it to be effective. One mechanism that is moving in the right direction is the recently piloted Trusted Notifier program that allows for rapid takedowns and limiting the actions of dangerous rogue online markets. With the clear lack of rules, this patchwork around internet access to medicines has significantly impeded the ability to generate consumer trust. trust being the theme that this workshop falls under, while at the same time making the case for credentialing of safe internet marketplaces. So to that end, a broad range of stakeholders now agree that a whitelist model can be perhaps a more appropriate way to go forward to balance access and safety, as opposed to the failed blacklist approaches that have been used to date. So as you hear, much has been accomplished from the work to date, but the challenges, they remain, and that's why we're here. Today, we'll have 3 blocks of conversation over the coming 85 minutes or so, where these and other issues will be delved into more deeply by originally 5 highly qualified individuals. However, we have lost 2, unfortunately, for this session. Both Dr. Gillian Kohler and Patrick Kane are not able to join us due to unforeseen circumstances, so we wish them both well in this moment. So block 1, our panelists will address 2 parts of the access to medicines question: its impact on the technical infrastructure of the internet and the impact around that technical infrastructure. Block 2 will be a discussion, debate amongst the panelists and you, the audience, so we can flesh out the issues that are on our minds and see if we can come to some conclusions. And block 3, in many ways for me, having been behind a lot of this work over the years, is really a pièce de résistance, where we'll be introducing York University's Dadeley Institute for Global Health Research new dynamic coalition on access to medicines using the internet and inviting participation. Ladies and gentlemen, the goal we are seeking is nothing short of renewing the patient-pharmacy bond of trust each and every time a patient's prescription and their prescription medicines arrive at their door. And through these efforts, internet pharmacies will indeed soon engender the same deep level of trust as that of the brick and mortar pharmacies today. So before we get started, a little bit of housekeeping. For all of you who've been participating for some time, we are very well aware, I'm sure, that the chat is for chat. And we encourage you to bring your thoughts and comments to the chat and engage with each other. Questions, please go to the Q&A box for questions. And we will then be reviewing all of the questions and addressing them in our block number 2. And then closed captioning for those who would like it is also available at the bottom of the screen. So please feel free to use that if you'd like. So I've asked the facilitators to open up the room so we can see who's in the room and give everybody a sense of who's here. So that's also very helpful. Feel free to engage with one another. So now I'd like to turn to our panelists, most of whom, for those of you who attended our RightsCon session earlier this year, you will remember. At RightsCon, we noted this would be a 2-part discussion. And with this IGF 2020 workshop, this is the 2nd part. And so here we are. In order to try to give us a sense of what is right and what is wrong, I thought we might start with a poll question. Last year, this will be for the facilitators, poll question number 1, if you would like to bring that up. Last year at IGF Berlin, one of our speakers, Gabriel Levitt, who is one of the initiators of the Brussels Principles, he opened his intervention with 3 questions that I'd like to ask again this year to set the stage for our conversation. He asked, how many of you believe that a person in one country who has a valid prescription but cannot afford their medicine should have the right to travel to another country that has much lower prices, buy it, and bring it back home? Answer yes or no. Let's say the person is too sick to travel. In principle, how many of you believe they should be able to order it online from a safe internet pharmacy and have it mailed to them from that same pharmacy that they'd previously traveled to? Is that reasonable? Yes or no? And then finally, let's say a person with HIV was traveling back from India to their home country with a 3-month supply of life-saving antiviral medicine. would that be in violation, would it be in violation of their human rights if a government officer stopped and took their medicines at the border because these otherwise lawfully manufactured life-saving drugs was not technically a registered medicine in their home country? Would that seizure be a violation of their human rights? Answer, yes or no. These questions are important to ask ourselves because I think often in the broad discussion of the complexities of how to resolve something, we forget just how important and the human nature element of it, the human aspect of it. So I wanted to bring these up on the table just to give us food for thought, put it in the back of our minds as we progress through this conversation with our expert panelists. So with that in mind, let's move on. Each of our speakers' bios are detailed in the IGF website, so I'm sure you've seen them, and if you haven't, you're certainly welcome to go there. We won't spend a lot of time going through them now. I'll ask each speaker to introduce themselves and their professional affiliation when I give them the floor. And I think that let's start with a little tour de table to gain insight from each of our panelists as to their respective remarks. So with that, may I turn to you, Bertrand de la Chapelle in Paris, to get us started.
Thank you, Ron. You asked us basically to, so I'm Bertrand de la Chapelle. I'm the Executive Director of the Internet and Jurisdiction Policy Network Secretariat. And you asked us to basically start with a sort of provocative question, statement or comment. And so, like I did in a previous panel where we worked together, I think there's an interesting analogy when we talk about this topic, which is that if you look at the history of the fight against abuses in the music industry, it was important to fight abuses, piracy, so-called piracy, but it was all the more important to try to develop appropriate frameworks for legal offerings. And the whole debate has considerably shifted now that there are legal offerings on music. Of course, medicines and music are not exactly the same, but I thought that as a provocative start, it was interesting to highlight this. Ron, do you want us to stay at the introductory statement, or do you want me to continue directly? You're muted. You're muted.
Thank you. The most famous statement in 2020, you're muted. Thank you. We'll circle back around. So we'll just do a quick tour de table. Thank you, Bertrand. Now let's go to Cairo and let's hear from Zina Hani. Zina, you have the floor. Have we lost Zina? Has she fallen off? I'm not seeing in my screen, but perhaps she has fallen off and will come back. So let's do this while we're waiting to see what happens there. I'm going to turn to Dr. Arya Ilya Ahmad in Toronto, Canada. Sir, the floor is yours.
Good morning. Good morning, good afternoon, and good evening, everybody. My name is Ron Zarizarya Ilyad Ahmad. I am the Global Health Foresighting Fellow at the Global Health Research Institute at York University. I am also on the board for Disclosure of Prescription Justice Institute, a US-based NGO, and have previously worked with the World Health Organization on issues of medicine quality. And that's been the basis of both my academic and my professional work over the last 15, 20 years. There are three major points that I will be making in my presentation later today. The first relates to the title of this panel, is that COVID-19, as with many other issues that have been covered at IGF this year, has rapidly accelerated the urgency of needing to address these issues. It's revealed both fault lines, but also offered opportunities around this issue specifically as well. Number two, that the existing regulatory landscape that is incongruent and opaque ultimately undermines public health. That's something I will be arguing and requires, in a sense, a more robust response. And number three, I'll be sharing some of my experiences, both from my academic work, but also with the WHO, on proposing a path forward that focuses on an appropriate forum and values driving the norms and standards development around this issue.
Thank you, sir. It looks like we're still, we've dropped Zina. And
Zina is unfortunately reconnecting right now, Ron, so
okay,
we can move on and she'll be right back with us.
Very good, very good. Thank you, Mark. So as you see, there's some very interesting ideas that we can shape these activities that we're undertaking here. And Bertrand, if I would turn back to you, and Internet and Jurisdiction Policy Network has been really actively working on the transnational aspects of the internet for several years now, and I congratulate you on that work. I also see Zina is back, so I'll come back to you shortly, Zina. Thank you. It's good to see you there. So internet pharmacies made up these highly regulated goods. There are trade issues and health concerns, and perhaps, you know, even more important, the human rights dimension. You know, what are the policy questions that these four different dimensions have? That, you know, how do we find that right balance? And looking at it through your eyes.
Well, I think it's we all know it's a complex question, and Internet and Jurisdiction as a policy network, as a group that is dedicated to issues related to domain names, we have not addressed directly the question of medicines online for the reasons I will mention, but there are a certain number of the things that have come out of the work of these groups that are useful here. And maybe I would like to do something in three parts. One is a general context dimension. The second one is, as I mentioned in the provocative statement, the fighting abuses part. And the third one is some thoughts on the legal offerings part. And what I'm saying here is only partly engaging the work that INJ has done. So there is a contribution also from my own past experience outside of INJ. In terms of the context, you said it, Ron, these are highly regulated goods. They are what is called controlled substances. So there is a patchwork of legislations around the world that apply to medicines with an enormous amount of regulation, and legitimately so. There are regulations regarding who can prescribe the medicines, doctors, who can distribute those medicines in pharmacies, who can manufacture those medicines, and an enormous amount of regulations regarding accreditation and acceptance in different countries of different types of medicines according to various rules of intellectual property, licensing, etc. And I'm not even putting in the basket at the moment the question of generics. So there is an enormous legal apparatus around this, and let's be clear, this apparatus, like many other things, is fundamentally based on territorial jurisdictions. And this is one of the reasons why, like in other topics, we are confronted with the tension between the cross-border nature of the internet, which is an amazing enabler, and the international legal architecture that is fundamentally a territorially based system. So, as you mentioned also, I want to highlight in this element of context that the issue of access to medicines online is a part of this classic triangle that we've seen in all jurisdictional aspects. It's the interplay between the dimensions of security, human rights, and economy. It is a security issue because there is a legitimate concern about what the WHO has called substandard and falsified medicines, which is a different issue from the question of licensing and the question of intellectual property and distribution. We're talking here about things that are literally harmful to people, including by drug cartels that are actually creating fake medicines in many respects. it is a general security issue because it touches upon the health of populations, and it can actually be extremely damaging, both on the one side of spreading bad medicines, or on the other hand, not having access to good medicines in situations such as the pandemic that we have today. So it's a health security issue. But it is also a human rights issue, of course, because there's the whole question of the condition of legal access to medicines, but also whether some products are illegal in one country and legal in another one. And there are many issues around that. And finally, it's an economic dimension because there's the question of the distribution of intellectual property. There's the question of the activities of pharmaceutical companies, the market prices depending on the developed countries and not developed countries. A part of the business model is allegedly that the high price in developed countries is also compensating for somewhat lower price to provide market in less developed economies. So it is a trade issue as well. And I just wanted to highlight this tripod because, like in many other topics, one of the goals is how to reconcile those three dimensions. So let me get now to the second element, which is fighting abuses online is obviously a major challenge. You can use a lot of expressions. It can be rogue pharmacies. It can be people who are just spreading completely falsified medical pharmaceutical components. Or it can be companies that have the right to sell in their own country, but not necessarily the right to sell in another country. And there are very different legislations regarding the general sector of pharmaceuticals online. In that context, one of the topics that we decided to address, and I will maybe take a little bit of what Pat Kane from VeriSign was about to say, not speaking for VeriSign in that regard, but speaking from the DNS perspective of problematic. One of the fundamental questions is, when we're confronted with an abuse on the internet, when is it appropriate to act at the level of the domain name system, like taking down the domain name or blocking access to a particular domain because of the activity that is underneath? The Internet and Jurisdiction Policy Network has one of its three programs that deals with domains and jurisdiction, and which is addressing exactly this topic. And I see in the audience some people, including Alan Woods, who was there, and Elizabeth Besudi, who is actually the director of the Domains and Jurisdiction Program. What I want to share here is that the focus, when we talk about abuses on the internet and action at the level of the DNS, there is a starting point, which is whenever you take down a domain, you suspend a domain, it has a global effect by definition. And it is a pretty blunt instrument. It is something, it is a yes or no, it's a switch. It's not something that is graduated where you can make it accessible in certain countries or and not in others. And so for all types of abuses, there's a need to meet a certain threshold that justifies acting at this level. That's the first issue. The second issue is that there's a strong difference between what is being labeled as technical abuse and content-related abuse. Technical abuse is, without belaboring, things like phishing, malware, botnets, where it is relatively widely understood that it is appropriate to act at the DNS level when a certain threshold is met, but all the actors are willing to act in that regard. On the content-related aspects, it is much more complex. It's much more complex, and obviously online medicines are in that category, because the thresholds need to be really particularly high. And I want to share with the group and with the audience, one of the outcomes of the work that we did last year, particularly in helping defining the thresholds that are appropriate. And I take this from the so-called operational approaches that have been published in April 2019, that says that for things that are related to content, acting at the level of the DNS is appropriate only if a certain threshold is met that takes into account, one, the degree of global normative consistency regarding the illegality of something. And I think in here, it would potentially be possible to consider that falsified medicines are a different problem than access to legal and proper medicines. The second is the proportion of a particular site that is actively dedicated to something that is illegal. If it is only a portion of it, taking an action at the whole level of the domain name is probably disproportionate. Third, the intent or the bad faith of the actors who are doing this. And fourth, the lack of available alternative measures to remediate this problem. And I don't put in this basket the fundamental question also of the geographic scope and reach of the domains in question. If you have a site that is entirely in a particular language, clearly directed at one country, there's a completely different question of whether it is simply accessible in another country, where it might be illegal, but there's a distinction whether it has been targeting that country or not. So I want to close this on the question of abuses, because working at the level of the DNS is a particularly important debate, and Pat Kane for VeriSign intended to also make the distinction between what in the domain name system is the distinction between second level domains and top level domains. And here there's a big distinction between the top level domains that are generic, typically a .com, a .net, or any other that VeriSign is managing, and dedicated top level domains such as .pharmacy that are dedicated to the sector, but I'll come back to that. The final point I want to make is, and so there's a burden, also a question of what is the responsibility of DNS operators to actually screen all the domains that they have under their responsibility to detect whether there is something wrong. And this is what has led to the notion of trusted notifiers and actors who act to notify DNS operators when there is a site that is supposedly meeting the threshold. One of the challenges is what is the authority of those notifiers and what is the national legal basis upon which they are building their notices. Is it the law of one country, mostly the US in particular, or is it a more general assessment of what is illegal? And I remember having had a brief discussion with some of those notifiers who basically were saying, you know, it is so difficult to address the question of substandard and falsified medicines, because indeed it is a very difficult thing. You need to test what is being sold. Because of that, they tend to focus on things that are more about licensing. So it is interesting to see that because of the technical difficulty of addressing substandard and falsified medicines, the focus is entirely or almost entirely on things that are related purely to licensing and intellectual property, which is an important issue, but not the only one. So that wraps basically the second part on fighting illegal things at the level of the DNS. And then the third part is more prospective, and this is not something that we have directly discussed in Internet and Jurisdiction, so I'm out on a limb on my personal capacity here. But I want to contribute a few things. One, clearly, there's a discussion about the notion of whitelist. And the notion of whitelist raises a very fundamental question, which is who creates the whitelist and who basically accredits or will accredit the pharmacies that would be allowed to function online. The second thing is, just like there's .pharma, there's the idea of the creation of a dedicated extension for pharmacies online that would be de facto the ones accredited through a vetting process to be able to register a second domain in .pharma or .pharmacy. One of the challenges, there are two challenges. One that have to be taken into account. One, this is something that was discussed when, for those of you who are familiar with the discussions in ICANN, when there was a discussion about .XXX for pornographic sites, or adult content, as it's called. And there was a huge debate regarding whether all adult sites should be going to .XXX, and some were concerned that it would be a sort of corralling of those sites and it would lead to a certain type of censorship. So the question of dedicated sites or extensions, top-level domains, is an avenue that is interesting, but the question of whether it should be the exclusive avenue or not is an important one. But the second question is, when you look at a top-level domain, here again, you get the question of where is this top-level domain based, and would it be the laws of one particular country that would apply globally for the registration in this top-level domain, or would it be a more diverse architecture, and would this top-level domain be the only one? But if you want to go further and finish with this, it is an entire architecture of accreditation that has to be taken into account, because everything here, as I said in the beginning, is being governed by very strict rules at the national level. Just like doctors have to get a diploma and be registered in an order at the national level that can take sanctions if the doctor is not doing things properly. Even if we put procedural rules internationally across borders, for instance, to say anybody must have a prescription to be able to buy something from a legitimate pharmacy. Who has issued this prescription? Is there a general scheme of accreditation? Is there a sort of adequacy mechanism that says any country that has validated a particular doctor establishes the right for this doctor to issue prescriptions for people who are outside of the country? That's a very big challenge. The pharmacies, likewise, are, of course, accredited at the national level. How much extraterritoriality is this accreditation going to be granted? Likewise, there are enormous trade issues and intellectual property rights regarding, in particular, the pricing of a certain number of medicines. And this is clearly in tension with the human rights dimension that I was talking about. So in a nutshell, it is at the same time an enormously important issue to address and an extremely complex one that I believe, and that's purely personal at the moment, absolutely requires to get the different stakeholders around the table, because this cannot be solved just by a trade arrangement, because it is related also to human rights. It is a security dimension. The companies have to be engaged, the civil society actors as well, because fundamentally what is at stake is what is the global regime internationally for accessing pharmacies and pharmaceuticals online. And that's a very big discussion that I do not see at the moment taking place with all the actors around the table. And I think I understand that this is one of the things that you're trying to trigger, but I wanted to paint the picture. So a very complex issue with at least 3 dimensions. Addressing the abuses cannot be limited to striking down in a whack-a-mole system one domain name after another. The real question is, what is the legal positive framework that will help address this issue? Thank you.
So that's, first of all, let me thank you for framing that so well, because these are clearly very broad parameters, we have to narrow this thing down. But you're quite right. It's really about getting all of the stakeholders around the table, and we'll be addressing that in Block 3. I'm excited to talk more about that and hear more about that. But I want to come back to you, Bertrand, with one question. And coming back to the, unfortunately, Patrick Kane was going to report back to us today on the status of the pilot program, but you were quite familiar with that. And I think the Trusted Notifier program is certainly the one that's, how would I say, is leading the charge in terms of the simplest solution for us to be able to resolve some of these technical issues. But do you think it's possible to have the Trusted Notifier program go through the ICANN policy machine and come out the other end with a board approval of that, and that might be the leverage for us to find our way through these complex issues you just elicited?
I will have to recognize that my following of the concrete work within ICANN at the moment has been less intense than it was in the past when I was on the board. So I would not have a sufficiently authorized comment on where it is inside ICANN. The only thing that I can share, though, is that this is one of the things that we have worked on for technical abuse this year. Whenever we talk about trusted notifiers, it is a wording that is loaded with a lot of assumptions. And it has to be addressed in terms of what do you have to do to be a trusted notifier? Who gives you the credential of being a trusted notifier? Is it just the fact that DNS operators recognize you as a trusted notifier, potentially make an agreement with you? Or is there a third party, can be ICANN or others, that says this is going to be a trusted notifier? Once you've solved this issue, there's a second one, which is on what basis, what legal basis and bases, plural, does the trusted notifier or trusted notifiers make their decisions and notify? Third, what are the due diligence steps that the notifier is taking to make sure that they do not just send anything that looks suspicious, but that has been vetted as being actually dangerous or negative or illegal? Because otherwise the burden is on operators who do not have the technical capacity to verify whether this is indeed an abusive content site or not. And the third element is that there is a question of what is the relationship between those trusted notifiers and the different operators? Do they have an authority? In other terms, is what they are recommended going to be enforceable in a certain way? And is there a problem of compliance if you do not abide? Or is it a notice that is being sent and there is an evaluation by the operator on this notice to see whether it should be followed or not? So the notion of trusted notifier is a very important one. And interestingly enough, I close with this, what we're discussing here about content and action at the DNS is very similar and mirrors a lot of the discussions that are happening on larger platforms, the Facebook, the Google, etc., the YouTube of this world, when we're talking about notifiers for illegal content, which can be terrorism, hate speech, copyright, and anything else. So the problem of notifiers is at the heart of the question of the distribution of responsibilities between the different actors, governments, private operators, and notifiers when trying to identify, evaluate, and act upon a situation of abuse. So it's a broader problem than what is just being discussed within ICANN, but some others, and maybe there are people in the audience that I see that would be in a position to answer your question more precisely.
Thank you, Bertrand. Thank you very much for that fulsome response. And I welcome anyone who'd like to add something into the Q&A, or we can certainly address that in our next block as we pick that up. I'll turn to Aria Ahmad right now. Aria, there's a need to unpack the opaqueness around this issue and the legislative incongruities that Bertrand has just brought up. They need clarity. We can't focus solely on tech. Rather, we need to focus equally on human rights. So this regulatory sweet spot that we've been talking about to avoid the pitfalls of over and under regulation. Can you expand a little bit about that? You know, what are the issues around the falsified medicines? What role can these intermediaries and regulators and patients all play in this movie? So please, would you take the floor, Arya?
Absolutely, and again, I think these are comments that I will expand, or these are issues that I'm hoping to expand on in my section as well. But particularly, in a sense, the way Bertrand, I think, very astutely is trying to draw on parallel issues that are complex, that are multi-sectoral, that are multidisciplinary, and require a multi-stakeholder approach. There are areas outside of initially the sort of paradigm of internet governance that are now being impacted by the digital marketplace. And as you alluded to, Ron, the issue of medicine quality and falsified and substandard medicines is one of them. And particularly because there is a significant risk to both under-regulating around this issue and over-regulating around this issue is this because they're controlled goods without adequate protections, without prioritizing public health and leaving the markets in a sense open, you create public health risks, of course, not just people being able to access products without a prescription, but also potentially substandard and falsified products that can present a public health risk. But at the same time, being restrictive or overly restrictive in enabling, in a sense, a digital marketplace that shift, that transformation is already happening in so many different domains in people's lives, that can ultimately undermine access and affordability as well. So finding, in a sense, that regulatory sweet spot, recognizing the risks of in a sense, leaving the market wide open, or being too restrictive and, in a sense, jurisdictionally bound when the digital marketplace, in a sense, transcends national boundaries, creates all these sort of blind spots that can ultimately not just lead to sort of first order risks, but also subsequent risks to both populations and access to medicines.
So the World Health Organization has indicated some interest in assisting the development of rules and around internet pharmacies to ensure this drug quality and security in the delivery chain. Can you shed some light on that and perhaps other regulatory bodies that would be of assistance in this and that have interest in resolving it?
Absolutely. So the World Health Organization is as sort of one example of a body, because part of what I think Bertrand is alluding to is when we talk about internet governance, both mechanisms and regulatory approaches to addressing these issues, it requires a number of important factors. It requires a sense of legitimacy. What are the bodies that have the legitimacy to address this issue, right? Is it a single state? Is it a third party actor that has delegated authority? Or is it a multi-state, a multi-sectoral? Is that feasible, or is it too cumbersome, for example? Because that's also a consideration, that you cannot establish an overly complicated system that no one is going to use. So the legitimacy is an important question, and the capacity and the ability to moderate that particular market is also important. And around legitimacy, for example, an entity like the World Health Organization or like regulators, not just sort of internet governance regulators, but also drug medicines regulators. So national medicines regulators have this vast network, not just within national boundaries, but across countries that attempt to harmonize rules, norms, practices around various drug regulatory issues. they both have the mandate and the legitimacy, but also around very particular core capacities and functions, the ability to monitor those markets. The challenge right now with the WHO is that capacity is an issue, not just with funding, but also the understanding some of the technical challenges. So that's why an entity like the WHO, for example, could take an active role because of it fundamentally is a public health issue, but it ultimately requires multiple different epistemic communities like internet governance, like trade, like IPR, like the enforcement angle, being able to work in a multi-disciplinary and multi-stakeholder forum where other non-state actors are participating as well. So the WHO pre-COVID was attempting, in a sense, to become more active around this issue, particularly through its work on medicine quality through a member state mechanism on substandard and falsified medicines. Not only did COVID sort of derail that, but ultimately it required more political will and more relevant stakeholders, in a sense, being able to participate. And part of the call for in that third segment of this panel around the DC is in a sense to sort of create, in a sense, that forum where we can have that kind of discussion with not just the WHO, but also many other both state and intergovernmental bodies as well.
Thank you. Now, and then I'd like just to have you, if you wouldn't mind, Mark has put into the chat your discussion paper that you introduced here at the IGF in 2019 in Berlin. Would you just give us the high points of that discussion paper and let us know where that is at in terms of what I'll call a focal point document for this activity?
Absolutely, and I'll keep it brief, particularly because I do see some names from last year that are here as well, which is really wonderful to see that there is a continuation of stakeholders across different groups that are recognizing that this is an issue that is, as Bertrand just said, an opportunity to address an issue at the heart of internet and social issues, but also one where we can draw on different experiences to develop clarity and clear guardrails. With the discussion paper for last year's IGF, the point really was to, in a sense, lay out the land of what the issues are, both from a very foundational internet governance perspective, from what are we really talking about in establishing rules and establishing regulations, leaning on INJ's very sort of important first edition of the global status report of in a sense, understanding what the jurisdictional and regulatory issues are around these issues, and then identifying, in a sense, the different stakeholders, the different scales at the sub-state, state, and intergovernmental level, and in a sense, making the case and making an argument for why you really need to get that sweet spot, that regulatory sweet spot right, and the risks of under and over regulation. And part of the, in a sense, where some of those participants who perhaps are a little more engaged in this conversation were sort of left on a cliffhanger is so what next? And in a sense, part of the objective of that discussion paper was to be just that, a discussion paper that invites an exploration of what some of the issues are, but also, in a sense, to make a case for why the so what needs to be a wider discussion among particular stakeholders and actors that perhaps at present are not at the table and ought to be at the table. And in a sense, making a call that process ought to be founded on a set of norms and values foundationally, and then have a permanent, in a sense, a forum where the thorny issues can be taken up, where the jurisdictional and regulatory challenges can be explored, and where we can't be naive around these issues of expecting very sort of simple guidelines to be established, but that you really need to work, in a sense, in that sort of policy domain on harmonizing rules and standards and norms in how you can promote a safe and inclusive and public health oriented marketplace for medicines online. And so that was, in a sense, the objective with that paper is to be inviting and to make the case for a transparent and inclusive process to be able to have these discussions. And in my talk, I'll talk and lean on my experiences with the WHO's member state mechanism on what that can look like.
Why don't you take a moment to do that just right now, and then I'll move on to Zina, and we'll take a Middle East, North Africa perspective. So if you take a few more minutes, and then I'll move to Zina, and then we'll move into block 2 for the Q&A. Thank you.
Sure. So on perhaps maybe just a 60-second background on what exactly the member state mechanism was. In 2014, the WHO, the issue of medicine quality was one of those highly contentious issues that we recognize the public health risks of medicines that could potentially be substandard and falsified, but also we lacked an international mechanism to address this issue. So you had a number of different approaches that were looking at the issue from very particular disciplinary perspectives. There was an enforcement angle that Interpol and UN Office of Drug and Control was undertaking. There was a private sector big pharma approach to the issue, which was largely based on intellectual property protection across jurisdictions, which is a legitimate trade concern. And there were various smaller sort of public health approaches that ultimately suffered from, similar to this issue, the jurisdictionality of it, because medicines are both a controlled good, but they travel, the global supply chain is now increasingly globalized and enmeshed. And so in 2014, the WHO established what was called a member state mechanism on substandard and falsified medicines. And the idea was that you would have a permanent forum within a governing body of the WHO, where states can address and take up the issue, and states, in a sense, having both the legitimacy and the mandate to address public health concerns within national borders. And you do so, you enter that forum based on an agreed set of values, that it is fundamentally, there are multiple issues around the issue of substandard falsifieds, but ultimately it's a public health issue. And if you are to develop norms and standards, it ought to come from that foundational understanding of what the values are. Now, some of the instruments and mechanisms that were developed within the member state mechanism in the last 5-6 years is more than what had been done in the last 30-40 years. Establishing a global surveillance and monitoring system for countries to be able to report cases. So that's the identifying bad actors, but also proactive mechanisms for what they called the prevention, detection, and response to substandard falsified medicines. So harmonizing regulatory practices, dealing with issues of medicines in transit, links between access and quality. And from that experience and having worked within the member state mechanism for about 4 years, and particularly establishing at the time the very first global study on the scale and scope of the issue. You can't really address an issue unless you understand how big of an issue is, where is it occurring, what are the public health and socioeconomic impacts. It was not until 2017 that we had the first sort of global scope of what the issue is. There were 3 lessons from that experience that I think might be valuable here. The first is that while this has very core internet governance challenges that need to be taken up, I would argue that this issue ultimately is a technical and a regulatory issue that cannot be solved without appropriate stakeholders that include national medicines regulatory authorities. Again, they have the legitimacy, they have the mandate, and they have the technical capacity to address particular jurisdictional and regulatory discrepancies. Now, it's unfortunate that Pat isn't here, but he would have talked about different kinds of internet governance approaches to dealing with these issues. When you're talking about, for example, smaller digital communities, you can, like certain top-level domains, you can have an audit system where you're able to screen beforehand who is entitled to, let's say, a top-level domain and who isn't. When you're talking about a larger, a more difficult, diffuse network, like a larger top-level domains like .com, you can have edit systems where you can identify, for example, bad actors. Now, similarly around medicine regulation, because it's a public health issue, you have similar mechanisms. You have market authorization, for example, which dictates who is able to sell a particular product and import a particular product into a country. So that's an audit system. But you also have edit systems. You have what's called post-market surveillance. When drugs are in the market, how do you take bad drugs out that either have adverse drug events or pose a public health risk? So that's why regulators, our drug regulators, are deeply important in this conversation. Number two is you need to be able to start with a set of norms that you begin, in a sense, recognizing that there are public health issues here. They're recognizing that there are, of course, trade and IPR and other issues, but you need to be able to establish these norms in a transparent way so that you avoid the opaqueness and you avoid the discretionary nature of how rules are developed, and particularly as it stands around conflict of interest. Now, in the issue of the member state mechanism, fundamentally or initially, it was really about abandoning the definition of the problem or how you frame the problem. And this is something else that Bertrand talks about is how are you framing the particular problem? Is it one of rogue actors, or is it one of how do you facilitate, in a sense, safe access to controlled substances in a digital marketplace? Likewise, counterfeit was an IPR issue that was abandoned for substat and falsified, and that process of deliberating that took a number of years, but it got all the countries together because everyone called it now the same thing. That wasn't the case 5 years ago, when different countries have different legal and regulatory ways of framing the problem. Now, likewise, in this on the issue of online pharmacies, access to medicines over the internet, as you alluded to, Ron, there was a multi-stakeholder process over a couple of years through both RightsCon and through engagement with ICANN and IGF of developing the Brussels principles on the online sale of medicines. And you can find those on brusselsprinciples.org, which uses, in a sense, UN-based language, recognizing certain core fundamental rights and affirming 7 principles that would be very difficult to challenge, in a sense, because they are so embedded in existing intergovernmental documents and language around the right to health, around access to medicines, and acknowledges, in a sense, different sectoral interests, but acknowledges that ought to be the foundation on which discussions emerge. And lastly, and I'll stop here, is this gets at the sort of the DC question, is that you need, in a sense, an institutional commitment. You need a forum and a process for deliberating that is inclusive, that includes all the relevant stakeholders, that is transparent, as we said, that avoids the opaqueness and discretionary nature, and ensures that you don't have rules made in one place affecting populations elsewhere or markets elsewhere. And that process, that forum, is in a sense the only way that you can avoid imposing rules, but actually discussing the thorny issues where you might have different, not just disciplines and sectors with a perspective, but different countries framing the issues differently. Now, there are other mechanisms that we can talk about in the Q&A, including the EU common logo approach that is within a very particular jurisdiction that looks at the issue of online pharmacies across the European economic area. You have, as I mentioned, within the WHO member state mechanism, you actually had an activity in the biannual work plan to deal with issues of online pharmacies and the internet that was disrupted and that required a little more also political will. And I would argue that in addition to the IGF, the International Conference on Drug Regulatory Agencies, ICTRA, which was previously the International Council of Harmonization. And that's really what they did is harmonizing rules around access and regulation of these controlled substances. Those are relevant stakeholders that could potentially participate on these issues. So just to sum up again, it's a technical regulatory issues that requires the appropriate stakeholders. You have to start with a set of norms that have to shape the conversation, and you need to have a forum that is inclusive, transparent, and multi-sectoral to deal with the thorny issues. Some of which that Bertrand alluded to, for example, with the trusted notifier system, but there are others like top-level domain, like .pharmacy, et cetera, that we can also talk about.
Thank you for removing some opaqueness, adding more clarity. Truly, what you've said in particular with that little summary is a perfect segue to our friend Zina in Cairo. And Zina, how does what Aria and Bertrand have shared look like to you from a regional perspective? The MENA region, Middle East and North Africa, is one cohesive geographical part of the world, yet the clusters are very different one from the other. And so very much like the problem that we see here in North America, where drugs in the United States are more expensive than Canada, what have you observed in the MENA region in this context? And, for example, is the same drug in Egypt sold cheaper in Lebanon? Is this a global challenge? Are these the challenges on the ground, the things that Bertrand and Aria have mentioned? How does it look from your perspective?
Well, thanks, Ron. Hello, everyone. So as chaos emerged left, right, and center during these stay-at-home orders and mandating of social distance, this raised an urgency to have such a platform to support the accessibility and local availability of safe medications, which is no longer perceived as a luxury, especially in the developing world like the MENA region, where personally I come from. Having an access to safe, affordable medicine is a fundamental right to all, especially in such crisis times. So as a matter of fact, implementing such a platform in the region would hinder a lot of problems, such as drug shortages and inaccessibility of drugs to a great extent. However, on the other hand, it cannot be denied that to intervene and attain such a platform would pose a lot of challenges in the region, like the MENA region, which is still struggling bureaucracy, outdated systems, and of course, limited resources. So before digging deep into the expected challenges and hurdles in this region that would face in order to intervene with such a platform, let me emphasize quickly on the characteristics of the healthcare nature of this region. So as you said, John, despite that the MENA region is considered one cohesive geographical part of the world, yet each cluster of countries is very diverse from the other when it comes to policies and decisions regulating the healthcare system as well. Also, the economic status of each country is different, and the health expenditure is different. So the system in Egypt would be very different than that of Levant, which includes Jordan and Lebanon, and both are very unlike to Maghreb region, which includes Morocco, Tunisia, Algeria. And correspondingly, all are very dissimilar from the Gulf region, which includes higher socioeconomic countries, such as Saudi Arabia, UAE, Kuwait, Qatar, Bahrain, and Oman. So not only that, but also countries within the same cluster in reality are different from each other. So accordingly, hurdles to adapt an e-pharmacy would differ from not only across the cluster in the region, but also it would differ on a country level within a single cluster. So as Bernard touched bases on some of the challenges that are there worldwide, having said that, let me also take you through some challenges that is aligned somehow with what has been touched on. that I can foresee that would hurdle implementing such a platform in the region. First thing is the reimbursement system, for example, which is actually very fragmented across the countries, where populated countries such as Egypt and Morocco have incomplete health insurance coverage, and a significant part of pharmaceutical expenditure is paid out of pocket. So that's a good thing in a way, that would allow the freedom of the end user to purchase their medication from where they want. However, elsewhere, as in UAE, Kuwait, Bahrain, Qatar, Saudi Arabia, the pharmaceutical spending is covered and is free of charge for the citizens. So it won't be a cup of tea for the insurance companies to adopt such a system in their practice. The second challenge would be the manufacturer's global pricing strategy that would be threatened upon having an e-pharmacy platform. Usually manufacturers sell the same drug in one country with a price that is totally different from another. For example, a drug that would cost $20 in Egypt might be sold in Algeria for $26. So having a transparent, competitive system that is clear to the end users as well as to the governments to cross-check prices would not be very welcomed by gatekeepers, whether the pharma companies or even the local distributors in the countries, as this would impose additional downward price pressure and less profit margins as such. So this would also create a problem between the pharma companies itself and the governments, who would want to borrow equivalent low prices as other markets. Another challenge would be the registration issues. Usually it's prohibited to sell a drug that is not locally registered. So having a wide range of drugs that are not registered within a specific country would not be allowed by governments and health ministries to be sold. Besides, labels and authorizations are another parallel challenge. For example, a drug can be registered for 4 indications in the US, but only for 1 indication in Morocco. So the drug will not be neither prescribed for an off-label indication nor reimbursed by the coverage. Another encounter would be the pharma companies itself that usually do not launch or delay launch or even withdraw a particular drug from the market, mostly expensive and innovative drugs in a given area, as they see the price they will receive from that specific market is excessively low, which result in access barriers and availability concerns in a specific country. In Algeria, for instance, companies are concerned about the spillover effect if they concede a price below the lowest in Europe, for example, in Greece. So again, this platform making medicines accessible would threaten the pharma global pricing strategies. Usually this is the case with the so-called large reference basket countries in the region, such as Egypt and Saudi Arabia. In other words, low-income countries such as Egypt could lead pharma companies to delay launches in country because of fear of low prices. So besides that as well, unfortunately, it happens that when a country or the flexibility of a country's pricing system, whether to accommodate external factors such as exchange rate fluctuation or consider inflation, can actually affect drugs availability within a country. As it would alter manufacturers' decision to remain in the market. Egypt was one of the countries that suffered from that back in 2016, where there were shortages in medicines for serious conditions such as cancer due to distributors avoiding to lose and sell medications under low price regimens. And unfortunately, that's the current situation in Lebanon for a lot of drugs, for example. Also, governments across the mentioned countries support significantly the domestic over the foreign manufacturing entities. Mainly they support through pricing, like in Egypt and Saudi Arabia, or through reimbursement systems and policies, such in Bahrain and Kuwait and Morocco, for example. Or even deliver support through taxation, such as in Saudi Arabia and Bahrain. All these efforts are to actually maximize the local production of medicines. In Algeria also, there is an importation ban on foreign company importers into the country when there is 3 or more generics are available. So having a wide platform of drugs would be against and counteracting to the countries and country strategies to maximize local production. Also, there is a movement towards mandating generic prescription that is currently in place in countries like Jordan, like Oman, like Qatar, and of course the UAE. Thus, governments would challenge such a platform that would make more unregistered foreign manufacturers available for end users, especially if they might be more price appealing and with the international standards. So last but not least as well is the e-payment systems and the e-prescribing systems in these countries. Well, actually the e-payment system is not fully developed in countries such as Algeria, such as Tunisia, Morocco, and even Jordan, especially when it comes to paying in foreign currency. In addition, for example, Maghreb region, the Visa and MasterCards are not owned by everybody. They are conditioned on sustainable occupation and certain margin salaries, so on and so forth. Also, the e-prescribing systems, the countries in the MENA region are so far away from that. So it would be such a big challenge on its own to change the whole prescribing practice in these countries. So basically, in a nutshell, gatekeepers should work together through a comprehensive, integrated strategy to allow such a hypothesized platform to operate effectively and efficiently. They need to move in the direction of public health, and there is a need to control bureaucracy measures and have a facilitated process to engage diverse groups together, whether governmental bodies, pharmaceutical companies, insurance entities, and also distributors, for example, to catalyze efforts to enforce this integrated framework. And those stakeholders should be engaged in a dialogue and have an organized expert advice on the mechanisms for better utilization of resources efficiently as tools to expand and leverage on the e-pharmacies in other regions, other developed regions. And also efforts to raise gatekeepers' awareness should be tackled on how such a model in other Western countries, for example, is efficient to support the accessibility and the availability and affordability of safe quality medications, thus providing a transfer of knowledge and experience for global norms and standards and guidance as a snowball effect. So that's it from my side.
Only that?
A lot of challenges, huh?
Oh, well, then that's why we're having this conversation. It's really, the perspectives that are being brought are so broad and varied. And I really am grateful that we're moving in this direction towards the dynamic coalition, which we'll get to in this next section. But thank you very much, Zina, for that really clear and somewhat disheartening report, particularly the fact that threatening pharma's global pricing structure, those kind of things really are huge roadblocks because we know the power that pharma has. We've been moving through this pretty rapidly with great interventions, but let's take a few minutes now. I've seen a few questions in the chat. Mark, can I turn to you for about 10 minutes to manage the questions and answers? And if everyone can just be really concise with your question and answer, we'll try and get all of them in, and then we'll take the last 5 minutes to move into the block 3. Thank you, Mark.
Thank you very much, Ron. So far, I think that the question that we could address right now comes from Tim, which would be, he says, I'd be interested to know from Aria whether the Brussels principles, a possible basis for establishing norms, has been socialized with any regulators or the WHO with whom he works. So I guess a bit of a question about how do we work with the Brussels principles framework in the context of institutions and what we can do about that. And following right up, we have a question from Jennifer Chung, which asks, how is the status right now in relation to discerning between counterfeit medicines and generics across the world? And since those are both institutional questions, I think that we can definitely start looking at them from Arya's perspective, who is our go-to expert, and then have the other panelists comment on that.
Thanks. Thank you, Mark, and thank you, Tim and Jennifer, for those questions. And in order to get it to as many questions as possible, I'll try to keep it relatively brief. On the question of the objective or the goal of the DC, on whether the Brussels principles have been socialized with regulators in WHO. Yes, to some extent. So part of our initial objective with this panel was to have a number of, I mentioned the national medicines regulators as a key stakeholder, is to have not just any, but one of the sort of top people in that space participate, and he indicated some interest. He's the head of the Indian Drug Regulatory Agency, who is now the rotating chair of the member state mechanism on substandard and falsified medicines. And also this year, when India was to host the International Conference of Drug Regulatory Agencies, he was the co-head of that process, who has expressed an interest in the Brussels principles, recognizes that a shared set of norms is foundational to having this conversation. And as you can imagine, India is oftentimes a very important and strategically important actor in a lot of tensions around issues of access to medicines. For those who are from the access to medicine space, issues around patents and intellectual property rights and generics, India played a significant role, and in no small parts because they are considered largely sort of informally as the pharmacy of the world, where so much of the raw ingredients and the finished products that make it to low-income countries are produced in India, not just because of the economies of scale, but also because of the capacity to produce them at such high quality, at such low prices. And so India is critically important in this conversation, but also because values, what are we ultimately trying to do, is a key foundation. So they have been involved, and as I said, the WHO had an activity to tackle this issue as well, and we're hopeful to re-engage that particular process. To Jennifer's question on counterfeits and generics, I wouldn't dare post my dissertations, but that's a lot of what my work, academic work background is in addressing these questions of definitional frameworks. Is a counterfeit, which is a term that within the access to medicine space is the one that's sort of fallen out of favor for the distinction between substandard, where you have something that's out of specification, and falsified, where there's a deliberate intent to deceive. That's sort of a distinction that at least doesn't obscure the fact that some actors might have different interests in approaching the issue, and gets at the public health issue and problem with both of those. And to the question of generics, which should never be sort of brought into these questions. If there are specification issues, that's one thing, but generics, the way the way all countries understand them is that they are safe, they are quality, and they're efficacious. So they're within a very regulated spectrum of quality, and those should not be, in a sense, confused with this particular issue. And I'll stop there.
Excellent. Thank you, Arya. So I don't see any other question at this moment, Mark, so maybe we'll turn to Bertrand. You wanted to add a comment, I saw on the note. Please, Bertrand, you have the floor.
Yeah, thank you very much. Just a few bullet points. The first thing is, in all those policy issues, it is extremely important that all actors look at unintended consequences. There may be a decision that is taken for health issues that has actually an impact on trade, or vice versa. And one of the challenges is to make sure that whenever a measure is envisaged, all the different dimensions are taken into account. I'm constantly taking the example from another space where the GDPR privacy protection in Europe has led to the fact that now I, as a French citizen, cannot access a certain number of news sites in the US who do not care about the European market and do not want to be bothered with the GDPR. So my access to information has been impacted by my protection of my privacy. So it's extremely important to have this in mind. The second thing is, whenever we talk about involving the stakeholders, I think we tend to implicitly forget that international organizations are stakeholders themselves, that the secretariats of international organizations are and should be considered, that's what we do in Internet and Jurisdiction, considered as full-fledged actors because they have a transversal perspective, but at the same time, in most cases, they have a siloed perspective because it can be discussed in the WIPO in a certain angle, and it can be discussed in the WHO with a certain different angle. And then when the trade comes in with the OECD or the WTO, it's a different angle. But each of them is providing a cross-cutting angle, and we should always keep in mind that processes need to be considered as stakeholders, just like individual companies or individual governments, etc. The next element is, I didn't mention it in my comments at the beginning, but how do you authenticate a prescription online? Anybody can forge a document. I even have people who told me in the domain name industry that they received fake court decisions. People were just taking the header of a court decision and making a completely fabricated document. So if we require prescriptions online, how do you authenticate that it comes from an actual doctor? And finally, I think, and maybe it's a segue to what you're going to say about the dynamic coalition. When the question was asked about whether Brussels principles circulated to the WHO and beyond, if you look at the people who are receiving stuff, they are very familiar with advocacy and lobbying. So there's one civil society group that is pushing a particular position, or lobbying group of interests that is pushing a particular interest or position. What international processes are not familiar with and need to be educated in a certain way and welcome this kind of input is multi-stakeholder input. And when you're providing something that is the result of the work of different actors, there's a part of an educational path, something that we are for INJ continuously doing. This should be given a different level of interest and credit because it is the product of a joint effort by government, civil society, companies, etc., than when it is purely lobbying or purely civil society advocacy. And I think people don't know exactly in which box to put those kind of contributions. And I think it will be important if the dynamic coalition develops to look at the balance of participants and to label the outcome of this group as something that is different from an advocacy position, etc. And I was just thinking of that, hearing the notion of the Brussels principles. The moment you label something as principles, it has a tone of advocacy, whereas a part of what we're trying to do, or what you're trying to do, is to bring the different perspectives and frame the problem in a way that all the different actors can afterwards use as a basis for their discussion. And I think it's an important distinction that we do not make enough. And I wanted to share as it came to mind as we were speaking.
Thank you very much for that. And in fact, there's been two responses from two bodies that actually are in the business of confirming trusted internet pharmacies in terms of the verification of the prescriptions. And I think it's important that it should be noted that the validation of prescriptions and verification of physician licensure are parts of the process at the Canadian International Pharmacy Association, Tim Smith, notes, and he says that there are ways to ensure documents are not being faced, but it requires diligence. And then Gabriel Levitt from Pharmacy Checker notes also that they can, a pharmacy in the UK, for example, can easily check the authenticity of a US prescription by checking directly with the prescriber in the US. So there are various ways of doing that. So it's good that you brought it to the table so that we can actually understand that element. So thank you to you, Bertrand, and also to Gabriel and
just
Tim.
one question, the fact, and I very much appreciate this, there's always a distinction between it can be done and it is done. So the difference between having something that would allow, for instance, a QR code on every single prescription that could be checked afterwards for accreditation, that is an authentication mechanism. The fact that you can call the person and say, is that really a prescription from you? Yes, but you will not do it all the time. The pharmacy in India, online pharmacy in India, is not going to call the doctor every time. So I would be very interested that this dimension of authentication is taken into account in the discussion. But thanks for the contribution.
And the same to you. Thank you for that. So here we are, ladies and gentlemen. We've been having this really robust conversation now. I see we have about 6 minutes or so left in the session. So what I'd like to do now actually is move to our second poll question, and then we will come back to our block 3 and talk more about the DC. So the second poll question, if our facilitator from IGF can bring it up, we'd like to know the answer to this question from our participants. It's a question we've asked before, and we're actually looking to see if there's any data movements here. And the question is, are standards and norms for safe internet pharmacies best accomplished at the intergovernmental level, or rather at the internet governance level? So Mark, if we can nudge our IGF facilitator to post that while we're moving on to this next session, that would be helpful. Are standards and norms for safe internet pharmacies best accomplished at the intergovernmental level, or rather at the internet governance level? That is the question. So I'm not seeing the question, poll come up, but let's see if it does. In the meantime, Mark, can I ask you to move to block 3, and can you introduce, please, the dynamic coalition we've been discussing during the course of this call? Mark, you have the floor.
Thank you very much, Ron. So I would like to acknowledge the incredible contributions made during this panel. I feel humbled to be a part of this effort. So many interesting ideas being floated around. And thank you so much for the panelists. Every time we meet, it looks like we bring up interesting and complex questions that we need to keep exploring. And for sure, this is a topic that we still have a lot to move forward. And that's exactly why we have been considering building this dynamic coalition on access to medicines using the internet. Now, we need to understand what is the broader community's vision, what are their potential contributions, and especially what is the right model, right? How do we advance these important questions that we keep stumbling upon? They are diverse, they are difficult, and they're important. So that's the conversation we want to have. How do we bring the multi-stakeholder perspective? How do we get these different points of view and we actually manage to create some sort of action around it that furthers our goals of just making sure that people are getting quality medicines at a price they can afford and that doesn't threaten their well-being. So what we want to do is to create a group, and it's still not 100%. I wouldn't say it's 100% that this is specifically a dynamic coalition. We can make a study group. We can make anything that makes sense for the community. It can be under the DC label, but it's a DC because we are gathering at the IGF, but we could be a research group. we could work on under different fronts. One thing that I know for sure is that we want to produce evidence-based material and gather that evidence-based material to serve as some sort of reference, a repository that's already lacking. So what is the format we want to pursue? How do we want to take this forward? Those are great questions. And we have the honor of having York University supporting us through ARIA. And that is a great institutional home for us as well, for us to do this kind of research, this kind of work. So it is a question that we're posing to the community. How should we go about this? What can we accomplish and how should we go about it? So I will invite anyone who has interest in this DC, who has interest in this research, or who knows of a person who would be interested in it, please, I'm posting some emails at the chat. One is more generically for the York University Center of Health. One is directly to ARIA, the other is directly to me. You can copy all of them, or you can send piecemeal, however you want. What we want is to hear from anybody who's potentially interested. What are your views on how we move this forward? And it's speaking to what Bertrand was saying, speaking to what Arya raised, and particularly to what Zina raised. That was very clear coming from her, that we have different regions with different hurdles, but that look fundamentally the same, right? At the end of the day, we have shared problems. And if we focus on those shared problems, I'm sure we can advance this a lot. So Jennifer, thank you very much. Jennifer is one of the MAG members that is with us. Thank you for your support, Jennifer. We are hoping that we can advance this conversation to the MAG as well. So I will finish my intervention by saying, please reach out to us. We are open to hearing your ideas and finding the best model for this. And, you know, we will do our best to assemble an inclusive, strong, dynamic coalition or research group, or whatever the community feels is good for us to be able to accomplish what we want, which is safe medicines that people can afford. Thank you very much.
Thanks very much, Mark. And indeed, we are really excited about this moving into this dynamic coalition. And actually, basically, rather than talking about this once a year, talk about it all year. And by this time next year, have some really important and exciting results as a result of the multi-stakeholder model that Bertrand and others have pointed out. It is only through the multi-stakeholder model that these things can be dealt with, because we get everybody around the table. So we're looking forward to that. I want to thank everyone for participating today. The poll results we will post once we get them back. And so as this brings our workshop 116, pandemics and access, or the 2020 assessment, how that looks, I want to thank all of the panelists and the participants for this conversation. It's been very fruitful. And with that, I wish you all the very best, and stay safe, wear a mask, and good luck. Thank you again for your participation today. Bye for now.
Thank you very much, everyone.
Thank you.
Thank you. Thank you, everyone.
Bye, everyone.
Bye, everyone. Thank you again.
Ron, I mentioned, okay, it's gone.